Serbia has become a pariah nation, untouchable like a leopard. Ivica Dacic. Ladies and gentlemen, world leaders, on behalf of the Serbian people, welcome to the Republic of Serbia. Dame I gospodo, dobrodošli u Republiku Srbija. I will start off by just explaining what I will be talking within this presentation. So with the introduction, where Serbia is located, information regarding Serbia, the issue, so what is the main issue and what issues are affecting the country. So when it comes to the situation, what was the past situation, what is the present situation on the issue. The stakeholders, so who are they and what are their views. Initiatives, so what are some current initiatives and events used to help this issue. Who is affected and what can be done. So what other nations are affected, if there are any, and what can be done to solve the issue. And by what can be done to solve the issue, that is meant by what can you as leaders from your other countries, what can you do to help Serbia? So, introduction. So, the Republic of Serbia, or in Serbian, Republika Srbija, has an area of 88,361 square kilometers. It is located in southeastern Europe, or the West Balkans. When it comes to religion, it is primarily Orthodox Christian, with 85% of the population following Orthodox Christianity. 5% follow Catholicism, 3% follow Islam, and 2% follow others. While these are numbers from 2011, numbers from 2025 would be significantly similar, and there would not be a change. The language in Serbia is that's spoken is Serbian. And Serbian uses both the Latin and the Cyrillic alphabet. The Cyrillic alphabet is used on formal documents, governmental documents, whereas the Latin alphabet is more of a informal use. There is 6.7 million inhabitants, and that is of 2025. And Serbia is a landlocked country, meaning that it has many, many neighboring countries. To the north, you have Hungary. Croatia to the northwest, Bosnia and Herzegovina to the west, Montenegro to the southwest, Albania to the southwest as well, North Macedonia to the south, Bulgaria to the southeast, and Romania to the east. When it comes to the people, the government is a democracy. The current leader, or the current president, is Aleksandar Vučić, and as you can see, that is his. This is his name in Cyrillic. He is the leader of the Serbian Progressive Party, or in Serbian, the Srpska napredna stranka. The prime minister is Đuro Macut, and the difference between the president and the prime minister is that the prime minister leads the country, and the president is more or less the face of the country. Wealth factors. Serbia is rich in natural resources, including wind, which is the most important resource of Serbia, and with the very first wind farm being located in Kula, which is a city in northwest Serbia in the region of Vojvodina. Water is the second resource factor, natural resource, my apologies, with major rivers such as the Danube, or Dunav in Serbian, and the Sava river supply the country with this natural resource. Arable land. In 2015, around 30% of the land in Serbia was arable, meaning that it was able to be used for agricultural purposes. Grapes. Now, this may sound weird to most, but grapes are a huge natural resource of Serbia. Farmers in Serbia grow grapes such as the Sauvignon Blanc, Pinot Blanc, and the Prokupas, which it is one of the oldest type of grapes you can find in Serbia. The most important vineyards are located in the Timok Valley, and they are famous for their red wines. When it comes to the GDP, the GDP per capita in 2024 was $13,486, with an annual growth rate, my apologies, of 9.8%, which you can see that is a significantly lower growth rate in comparison to 2023. Looking at the quarterly GDP of 2024, when it comes to market prices, there weren't much of a difference. When 2024 started, the GDP was 21,538 million USD dollars. And at the end, it was rounded to 23 million US dollars. So when it comes to the beauty of Serbia, Serbia is a very beautiful country with lots of beautiful land. So as you can see, some highlights include the Uvac River, the Viktor, which is a very important monument and statue, the Temple of Saint Sava, which in Serbian is the Hram Svetog Save, which is one of the largest Eastern Orthodox churches in the world, and it has the largest mosaic of Jesus Christ in the world. In the top left corner over here is the Golubac Fortress, or otherwise known in Serbian as the Golubačka tvrđava. So the illegal NATO bombing of Serbia in 1999. So NATO, led by the United States and Yugoslavia, ex-Yugoslavia, I should add, which at the time was Montenegro and Serbia. So what happened? So the United States, alongside NATO, bombed Serbia and parts of Montenegro. When I talk about Serbia in this presentation, that does include Kosovo as a Serbian province and Serbian region. So in this presentation, it is not considered its own country. So this happened in March 24th in 1999 to June 10th, 1999, lasting 78 days with many, many casualties. So as mentioned, it happened in Serbia and parts of Montenegro, and most sources say that it is due to the Kosovo conflict, but there are many other political issues that occurred that led up to this moment. So how did this happen? So the United States, or NATO, used uranium depletion and cluster munition. Now, how is this considered illegal? Why is this considered illegal? It is considered an illegal bombing as NATO and the United States did not seek permission nor approval from the United Nations Security Council to bomb former Yugoslavia. So hence, out of that reason, it is considered illegal. Moving on to the issues. So the main issues facing the country, the first one being corruption. So government corruption is a huge issue in Serbia and an issue that leads to the deaths of many citizens. This issue ranges from law enforcement to politicians. Next up is poverty. Poverty is another main issue that Serbia is battling. Many people do not have enough money, as the average salary in Serbia is around 123,000 RSD, which stands for the Republika Srbija dinar. That converts to roughly $1,637.13 per month, which when calculated is an annual salary of $19,645.56 Canadian dollars, and that is before taxes. Furthermore, most senior citizens or the elderly are unable to survive on their own in terms of they have to live with their children. And this is all due to the very low pensions. The average pension in Serbia is around 50,683 dinare, which is around $674.59 Canadian per month, which annually comes to an annual pension of $7,771.08. And illness slash diseases. Many people, such as the elderly and children, encounter diseases and illnesses. The big issue with this being also comes back to the poverty issue. They are unable to treat their illnesses because they do not have the money. Public health care is not the best in Serbia, so people tend to go to private doctors and private clinics, and that does cost, and the costs do add up. So the main issue, the issue that I am bringing towards you and that I want to discuss is the rise of cancer in children. So this is following the illegal NATO bombing of Serbia, or former Yugoslavia, in 1999. It has resulted from the depleted uranium, and that still lurks in the air, and it still pollutes the air, and the citizens do breathe it in. So, depleted uranium bombs and cluster munitions that were used in the bombing are the cause of this. It most commonly affects children. Those that were born between 1999 and 2015 in Serbia and parts of Montenegro are the most prone to contracting cancer, either as a child or sometime within their life. The most common tumors are neuroectodermal, which, according to the National Cancer Institute, affects the primary central nervous system. So that's where the tumor lies. This means that they begin in either the brain or the spinal cord, and affects children aged 0 to 4 years old. The next common tumor is blood. According to Cleveland Clinic, blood cancer endangers an essential life force, your blood cells. So this essentially affects the blood cells and affects children aged 5 to 9 years old. The next common tumor is brain tumor. According to Mayo Clinic, a brain tumor is a growth of cells in the brain or near it. Brain tumors can happen in the brain tissue. They can also happen near the brain tissue. Nearby locations include nerves, the pituitary gland, the pineal gland, and the membranes that cover the surface of the brain. This affects children aged 10 to 14 years old. And finally is solid tumors. Solid tumors are an abnormal mass of tissue that usually do not contain cysts or liquid areas. That is according to the National Cancer Institute. And this affects children aged 15 to 18 years of age. So what type of issue is this? This is societal and environmental, as it affects the nation and affects mostly children. It affects the citizens. It is environmental, as the cause of the cancer comes from the polluted air from the uranium depletion. And finally, national and global. So this affects both the country of Serbia, and this includes the Serbian province or region of Kosovo. And it is global, as it also affects the country of Montenegro. So it is cross-border as well. So the situation. So the past situation. In the past, so the rise of cancer started in 1999, and mortality rate decreases 0.9 annually, 0.9% annually, my apologies, and this has been happening, this has been decreasing since 2009, so some positivity in the situation. The present situation, so in 2022, there was a total of 42,039 total cases of cancer. This includes from children to adults, and this is from the bombing. 22,910 cases are male, and 19,129 cases are female. Majority of these, unfortunately, are of children. As you can see, the highest amount of cancer is, the most common cancer, my apology, among men is lung cancer, and the most common cancer among female is breast cancer. As you can also see here, in 2020, 2018, the number of cases, there were 49,043 new cases in both genders. Moving up to the stakeholders. So the main stakeholders include patients, healthcare providers, researchers, pharmaceutical companies, and policymakers. And now, what are their views though? So the views of the stakeholders is that there is good healthcare. The healthcare system in Serbia is significantly better than the healthcare system in North America. Now, the public healthcare system is not the best, but the private health clinics and the private healthcare is significantly better than the free healthcare. So, in terms of that, there's good healthcare. Insufficient funds. So, Serbia is not as rich as Western European countries or North American countries, and that is where the issue of the healthcare lies. Finally, there's inadequate staffing, so not enough healthcare providers are working in the oncology or hematology departments, which is the departments where cancer is studied. Initiative and events. So one event is called Ja se borim, which was held in the Republic Square. And it was an event from 2016. It supported children with cancer, and people who attended, they could purchase green balloons and other promotional items. And then the money that was earned, the proceeds went to build a new hematology and oncology department in a hospital in Niš. Niš is a city in southern Serbia. Who is effective and what can you do? Or in other words, what can you as the world leaders do? So, who does this affect? This is a cross-border issue. It affects children in Montenegro, and it also affects children in Kosovo. So, why should you care? Why is this an issue that should even be mentioned, talked about, or even helped? First of all, dying children. I would like you to close your eyes and imagine two scenarios. Here's the first one. Imagine you alongside your child. You find out that they have cancer and they may not make it. How would you feel? Put yourself in the shoes of a parent. Now, here's the second scenario. Imagine you are the young child and you find out that you are sick. You don't understand why you're sick, but you know you are sick because you don't feel well. But all you know is that you may not survive this sickness. How could you let that? How? It's very hard. This would improve the future in terms of by helping save the children by treating them and treating my apologies the children affected by this horrible disease. You can help improve the future as some of these children will become future doctors and maybe the doctors that are taking care of you when you're sick. And then finally, you're reducing suffering. Imagine a child laying in bed in agony. How can you sit at your desk and allow this to happen? How can you do this and not care about those unfortunate children? And finally, it would reduce trauma. So some of these kids and their families go through both psychological and emotional trauma, and this is very, very immense trauma. So, what can you as world leaders do to provide help? First off, you can help by providing better medical care. Yes, I did mention that the private healthcare is great. It's great when it comes to having a cold, having a fever. It is not great when it comes to having a disease such as cancer. So you can help by providing better medical care and by sending more experienced doctors, sending better medicine, more improved and more modern medical technology to help treat these children. Second off, lower housing costs. People living in Serbia, as mentioned, do not have money. More often than not, families have to leave the country to go help fund and treat their kids. Typically, they go to Western countries, Western European countries such as Germany. Some even go make the trip all the way to the United States to be able to receive the medical care. By having lower housing costs or even free housing, this helps relieve the families from financial burden or hardship, and they don't have to worry about having a roof over their heads while paying medical fees. And finally, having lower medical costs. As mentioned, this also ties into the previous point. As families have to go out of the country and have to go farther away to get their children treated. Obviously, these medical costs in other countries do not come cheap. So there should be kind of like a support system in terms of like a scholarship or when it comes to universities where the families they would apply, and if they qualify, they would be able to have lower medical costs or even free medical care. And these factors could include salaries that the parents make, where they live, how they live, what's their standard of living, and so much more. And finally, coming to the conclusion. So, in conclusion, your aid, your help, and your financial support would be able to help many children in Serbia and Montenegro have a longer life. These are tiny human beings who have so much more of the world to see and so much to experience. Who would we be to rob them of such an experience, given that they didn't ask to be born, and they especially did not ask to be born in a country that has such devastating pollution from such a terrible past. So, on behalf of the Serbian people and the Serbian children, we thank you for listening and hope that you are willing to help make a difference and help cure the lives and better the lives of our future. Thank you and have a great day.